Over the last year, many have lost loved ones, but even the grieving process has been as strange and frightening as the pandemic. No large funerals meant the absence of the usual comfort of family and friends. Celebrations, birthdays, graduations, and marriages were all reduced to small gatherings. The year has been a new and unmatched experience the country continues to go through. 52-year-old Ratna Babulal from Good Hope, East Coast Demerara, was the first confirmed case and death in Guyana. She died on March 11, 2020, days after arriving in the country from the United States with her husband and children. The Babulal family is also recorded as the first group of persons to test positive for the virus. The majority of the deaths from the virus was recorded in Region 4, Demerara Mahaica, the largest populated region in the country, and according to health officials, everyone who died suffered from underlying conditions or what can be referred to as comorbidities. A retired nurse of the Georgetown Public Hospital lost his battle to COVID-19 on October 5, 2020. The nurse, Mark King, was 55 years old. He was last stationed in the Accident and Emergency Unit, and doctors say he was one of the best nurses to work with. King retired in July 2020. King had underlying conditions and was admitted to the COVID intensive care unit on September 25, 2020. His father, Kenneth King, during a recent interview with the newsroom, said he was not aware of the extent of his son's illness.
But when I was told the cause of his death, I was a little surprised. His sickness was, I wouldn't say long, but a few weeks. And I was surprised and taken back at his death, so to speak.
Meanwhile, a 6-day-old baby with a heart condition and an 11-year-old with leukemia were recorded as the country's only deaths as it relates to children. The oldest person to survive COVID-19 in Guyana is Zori de Matos. De Matos, who is a resident of the Palms Elderly Care Facility, is 106 years old. Within a few weeks of the pandemic, many lost their jobs and were laid off, and even now, businesses continue to suffer as a result of the pandemic. In recent months, the National COVID-19 Task Force granted approval for non-essential businesses such as resorts, bars, and restaurants to open with strict measures and limited capacity. The government further extended the national COVID-19 measures for the month of March, which means that the restrictions against social activities remain in place, and the 10:30 p.m. to 4 a.m. curfew is still in effect. The restriction on private parties, wedding receptions, wakes, and the usage of hotel pools also remain in effect.
So how I see the health sector from COVID to now, I have seen the health sector grow, and that not in the number of persons, as in number of staff increasing, but I've seen the health sector grow in mentality and in capabilities, as in watching your colleagues, not knowing what illness this is and knowing that it's something new and it's something that we do not know about, and just seeing us grow in knowledge, seeing us willing to push ourselves, go the extra mile.
That was the doctor in charge of the Infectious Diseases Hospital, located at Liliendale, East Coast, Demerara, Dr. Tracy Bubble. Dr. Bubble has been serving in the health sector for the past 13 years, and prior to the pandemic, she was the emergency medicine specialist trauma coordinator at the Accident and Emergency Department of the GPHC. Even before the first confirmed cases in the country, Dr. Bubble said preparations had started months earlier in anticipation of the virus. She said while the health sector was preparing for mass casualties, the health workers had their fingers crossed that the virus would not enter Guyana.
Then March 11, 2020 happened, and we had our first patient, and with our first diagnosed patient, we had our first death in Guyana. And that really drove it home, as in it really brought us into reality that COVID-19 is coming.
She said it was scary at the time in terms of not knowing what to expect with patients, how to treat them and their complications with the virus. But with the experience, exposure, evidence-based medicine and scientific studies, the health workers are now better positioned in their response to the pandemic. All of this was further complemented with the completion of the COVID-19 hospital in July 2020. Before the completion of the hospital, COVID-19 patients were being treated at the Georgetown Public Hospital. A clinical group has also developed specific guidelines on how to treat COVID patients. These protocols and guidelines have since been standardized and adopted in hospitals across the country. With the development of a number of vaccines, there is now hope that the end of the pandemic is near. But Guyana still has a long way to go in order to achieve herd immunity and be COVID-19 free. And with every passing day, the Ministry of Health is reporting new cases. Dr. Bovell is among the first set of doctors who received the Oxford AstraZeneca COVID-19 vaccine.
Now that we have the vaccine, I'm hoping things will start looking up. I'm hoping that we can get everyone vaccinated and ensure that at least they have protection, and we can continue getting better from here on.
The country began its COVID immunization on February 11, 2021, with a donation of 3,000 doses of the Oxford AstraZeneca vaccine from Barbados. The country has also granted emergency use approval of the Russian Sputnik COVID-19 vaccine, as well as China's Sinopharm vaccine. Each Guyanese will get to choose whether they want to be vaccinated. But the Minister of Health, Dr. Frank Anthony, continues to say that these vaccines are safe and that scientific studies have shown that there are low side effects. It should also be noted that a national committee was set up to monitor any adverse effects of the vaccines. Persons are still being advised to take the vaccine in order for the country to start its recovery from the pandemic. Sister Shannon Hayes, who is now a ward manager at the COVID-19 hospital, was initially stationed at the maternity unit of the Georgetown Public Hospital. She is one of the many health workers who continue to work on the front lines. Hayes told the newsroom that she saw the opportunity to do her part in the fight against the virus.
For the longest while, I'm actually from Essequibo. So my family is in Essequibo. That was why I even took on the responsibility of going, because I knew I wasn't going to be putting my family at risk in any way, because they're there and I'm here. And I was thinking about the other persons that would have their family and they would have to go home to them.
Meanwhile, many of the indigenous villages in the hinterland regions were placed under lockdowns and were the epicenter for the pandemic. Maruka, located in Region 1, Barima Waini, in the beginning of the pandemic, was one of the hotspots for COVID in the region. Dr. Daron Munsami was stationed at the Kumaka District Hospital in Maruka as the doctor in charge at the time. 1 month after Maruka recorded its first case, Dr. Munsami tested positive for the virus. Now one of the 8,000 survivors, he recounted his experiences to the newsroom.
First, I was working with COVID patients. I was a doctor seeing, we had 27 patients at the time. And I felt unwell, just tired. I didn't feel fever or anything then, but I felt unwell, and I was telling the nurse, like, I'm not feeling good. And you're joking and said maybe it's COVID. But then at night I got fever, and then my eyes started to hurt. And I was thinking dengue, because I was in isolation in a hotel, because I'm working with COVID patients, I couldn't go back home.
In February this year, he relocated to the Georgetown Public Hospital and no longer works with COVID-19 patients. Nevertheless, he credited the team at the Kumaka Hospital, who continue to work tirelessly to ensure the safety of every patient and staff. The National Public Health Reference Laboratory during the first 7 months of the pandemic was the only certified laboratory to do PCR COVID-19 tests. With just one certified lab testing for samples for the entire country, the health minister was faced with a huge backlog of samples, and this also resulted in results taking longer than usual. Now, two privately owned labs, Eureka Medical and Coastland Diagnostic Center, are certified to conduct PCR testing. Additionally, the government has also implemented rapid antigen testing, which is done within 20 to 30 minutes. GenExpert machines are also being used to carry out COVID-19 tests. The machines were previously used to test persons for tuberculosis, but have now been recalibrated to test for COVID-19. With new and highly transmissible variants of the virus discovered in the United Kingdom, neighboring Brazil, and South Africa, Guyana remains on high alert. A year later, and schools across the country remain closed, with only face-to-face learning for high school students writing CSEC and CAPE exams. Children continue to be taught via online classes, but in a country with limited access to the internet, this remains a challenge for many parents. There is some hope that schools will reopen after the Easter holidays, as long as a majority of the population are vaccinated against the virus. From all indications, the coronavirus will be with us for a long time, and the onus is not only on the government to ensure that we are safe, but for us to also practice and adhere to all the safety guidelines in order to curb the spread. Wash your hands frequently, wear your mask, and keep your distance. Protect yourself so that you can protect others. I am Danielle Swain.